Tenía cálculos en la vesícula, en la cirugía. Okay. So, hello. Good afternoon. I will provide today we perform some cases for the Mexican Association of Digestive Endoscopy to perform this transmission of this interesting case. So today I will use US scope. This is the new endoscope for endoscopic ultrasound with 4.0 millimeters of working channel. This is the EG38J10UT series from Pentax Medical. So now I am using a Loca Arieta 850 machine. So you are looking, the quality of image is very interesting. And here is the problem of this patient. This is a 44 years old man with history of alcohol consumption and two pancreatitis crisis. The last one recently with this pseudocyst, pancreatic pseudocyst with wall of necrosis. So the situation is that I would like just to confirm the quality of this cystic lesion, because just to avoid any complications, sometimes some patients we can have some. So I think I am in. So now I am using a 22 gauge needle just to perform aspiration of this area. I don't see my needle. ¿Se puede estrenar el endoscopio? I think I am in. I'm doing my aspiration now. Nothing is coming. I am in. So I am in. There is nothing coming. So why I'm doing that? Because sometimes we can have patients with other kind of lesions. Ten aquí. Voy a crear una aguja 19. Okay? And probably, you see, my needle is inside. Préstame para aspirar. And probably we can have another kind of lesion that are performing recurrent acute pancreatitis. So probably we are wrong, and this patient is not a pseudocyst, and this could be also a mucinous cystic lesion, and you see, nothing is coming, nothing. And this, in theory, if this is a pseudocyst, normally this area that I am performing my aspiration becomes other kind of liquid, and I don't have nothing with a 22 gauge needle. So I will change my needle. Dame una aguja 19 normal. And I will pass, because the position is a little bit difficult. So I will pass, I will do an aspiration. I'm not so sure that this is a pseudocyst, and probably could be a mucinous cyst lesion, and we are doing a misinterpretation of this lesion, okay? So that's why it's very important sometimes to do an aspiration, just to avoid any So I'm using a 19 gauge needle, a standard needle. You see, we are in the second portion. This is this lesion is in the head of the pancreas, but also taking a little bit the uncinate process. So that's why I'm not so sure that this is a pseudocyst. It's not common to have this kind of lesion in these positions. So this patient just have abdominal pain, and with this wall of necrosis, at least fever could have this patient. That's why I try to be sure that we are in front of a wall of necrosis. So now I am in, not very good. You see, Rachel, Raquelita, I'm not so sure that this is a pseudocyst with wall of necrosis. Very nice case. Good for discussion. Thank you. So I am in again. I am doing my aspiration and I don't see nothing. It's not coming nothing. Look. No. No fluid. So I think that probably this is another kind of lesion. Look, this is the head of the pancreas. So I am with the linear scope, and I think we need to change our strategy now. So at the beginning we tried to do drainage, but now I am not convinced to do a drainage. It's more. Ten aquí, Raquel. Así. I am inside. Look. Oh, yes. Now it's okay. Now it's okay. So this is a pseudocyst. Okay, what I will perform now. Look, this is very important, huh? The quality of the liquid. So now, this is good. Now I'm sure that this is a pseudocyst. Look the quality of the liquid. Okay, so, quiero una guía. I will pass a guide wire because the position is very difficult. And I need to pass axios. But due to the position, I will use 10 by 10 axios. I don't need to use a necrosectomy now. I need to perform more than all drainage, and then I will pass a little bit of Ok. Quiero ver si estamos bien con mi guía. Ten aquí. So I don't see my guide wire. I think I am okay. I'm okay. Quiero empujar la guía. So my guide wire is in place. I can see by endoscopic ultrasound. Necesito que Claire me ayude acá. So now I'm okay. My needle is here in place. My guide wire is in place. Look. Just the position that is very difficult. Huh? So sometimes we need to use a guide wire. Okay, necesito que empujes. Sí, sí, por favor. This is the case that este es el caso que tiene un vaso o no? Periférico. Okay. So we know that this at CT scan, this lesion have a vessel. So we are okay. I think I am not passing any vessel. Quiero un Axios de 10x10, okay? So I will use an Axios of 10x10 and we'll perform the drainage. Gracias. Ten aquí. Ahí. And then I will clean with ¿cómo se dice? Agua oxigenada en inglés, ¿no? Peróxido de hidrógeno no es. No, peróxido de hidrógeno creo que es, ¿no? I'm sorry, my English is not so good. Ah. Ah, está Juan Manuel, no hace nada Juan Manuel.
Está difícil.
Ah, obvio. What? So, I am very tortuous. That's why, that's why I didn't use a. Tú cierra.
No sé si estará bien.
Ok, ahí estamos bien. Sí, sí, la punta ya salió. I'm not sure. Okay, no vessel. Ten aquí, así. Eso. Solo no rompamos el eco. No. I am in. So we are there, huh? Okay, we are fine. You see, very difficult position, huh? Very difficult position, huh? But now I am okay, huh? I can see now, huh? So now I am. Cuidado. Perfect. Very difficult lesion, huh? I'm okay now. Now the drainage is complete. You can see. I think this case is very interesting because of many points. So the position is not easy. Now it's raining, okay? The position is not easy. There was a vessel at CT scan that we needed to avoid. So that's why, because the position and the vessel, we use it. I use the Axios, but using the guide wire. Okay, so now I'm okay. I will pass a gastroscope. This patient already doesn't. Well, this patient doesn't have gallbladder now. So now I will pass my gastroscope. I want to perform a very good aspiration now. Quiero la imagen endoscópica, Bolaños. So we are okay. ¿Puedes decirle a Bolaños que quiero la imagen endoscópica o no? Ah, ok, ya estamos. Look. ¿Dónde están mis Axios? Aquí está. So look, the position was very difficult, huh? Now it is okay, huh? So now I will pass, ¿cómo se dice? El agua oxigenada, ¿no? Hydrogen peroxide solution. So, but this is with a dilution of, ¿en cuánto está diluido? So I will use my solution at 1.8% of dilution. So it's very important, the dilution, but it is important to know that I am using gastroscope that have a 3.2 millimeter of working channel. This is a Pentax gastroscope. Necesito un esfinterótomo. I will pass a sphincterotomy inside. Okay. Look, this is the necrosis, huh? This is the necrosis. I will pass hydrogen peroxide. Okay. And I will put this hydrogen peroxide inside, and we will see the evolution of this patient. So very nice case, huh? Oh, okay, ya estamos adentro. Dale. So we are passing the solution now inside.
¿Otra más?
Sí, sí, más. So, and I am using the water jet. Sí, 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 sigue.
Estoy pasando, estoy pasando. Ya van 2 ml.
Sigue.
10 ml en 5.
Sigue.
3 ml. 15 en solución. ¿Sigo?
Sigue. So this is easier, and because of the difficult of the position, so it's better to use now the hydrogen peroxide to clean this wall of necrosis. So we will see the evolution in 7 days or 10 days. I will perform a CT scan, or you can use abdominal ultrasound EUS just to see if we need to perform a necrosectomy in this patient. But today we will less this, just this. Continue. I am using my water jet channel of the scope. Okay.
10 ml de agua oxigenada.
Listo. So we passed 10 ml.
Sí.
¿Solo 10 ml pasaste? No, imposible.
10.
¿Cuánto tienes esto? ¿Cuántas veces pasaste?
Por eso, 10 es.
10 de estas.
Sí.
So we passed 50 ml. Okay? Inside or pseudocyst. Okay, empujo una guía. And I will less a small que una prótesis de 7 French en cola de cerdo. Tenemos
Ya lo vamos a ver.
por 7 por 6. In this case, I will less pigtail inside, but because of the vessel that already has been detected at CT scan, so that's the reason why. Normally, I don't use a pigtail. This is just to avoid any complication of bleeding in the next weeks. So the idea is that this patient rests with this at least 15 days, and we need to see what happened. The pigtail is not for drainage, it's just for protection of the vessel. ¿Ya estamos? ¿Estás seguro? ¿Está duro? Okay. Look, this is the effect of the hydrogen peroxide inside the cyst. So now Empuja. Empuja. No estás empujando. So now we are okay, and I will pass my stand and I will finish my procedure. Okay. ¿Me pasas 7? ¿Tienes de 7 French o no? Pigtail, ¿de cuánto? 7. No muy larga, una más corta. 7 por 5. So I will use a pigtail of 7 by 5 centimeter long because the length of the axis is very short. So the pseudocyst is at least 8 centimeters by CT scan and by US 7 centimeters. So I think we'll be okay. Pásame un balón de dilatación de 10 milímetros. I will perform a dilation first. Ese está bien, perfecto. Sí, quiero el... No, de 10 necesito. Perdón, ese es 12. I need a balloon dilation. I will perform a balloon dilation. And I will use... No, está bien. Sí, está bien. Sí, está bien, perfecto. 7 French. Sí. So I will perform a dilation of the axios because of the necrosis to avoid an obstruction of this, and then I will pass the pigtail just to prevent bleeding due to the vessel that already is behind this pseudocyst. So we'll perform a dilation until 10 millimeters. This is a 10 millimeters hot axios. So I am using a balloon dilation of Cook Hercules balloon dilation. So don't forget to join us in during our live course that will be performance 17 and momento and 18 October 18. This is together with the World Endoscopy Organization. Perdón, cuidado. Ok, quiero que dilates. Momento, dame un segundo. Perdón. Ok, ahora sí puedes dilatar. Dilata. Hasta 10, ¿no?
¿Ya?
¿Ya está dilatado a 10?
Voy a entrar. Dos de 10 de ya. Uno,
Sí.
medio. Ya, está hasta 10, ¿eh?
Okay. So we already perform our dilation. It's perfect. Okay, listo. Desinfla. Sí. Gracias. Cuando estés aspirando me avisas para retirarme y empuja la guía, ¿no? So the idea is now to let our guide wire in place and to pass our pigtail. Okay, empuja. So again, why I don't use a 15 mm Axios, it was because of the position, very hard position, so the catheter is a little bit hard to pass in that angulation. Okay, empuja. Empuja. Se está viendo la guía. Sí. Creo que perdí mi guía, ¿no? Porque no la veo. ¿Puedes poner la mano aquí, por favor? Ahí. Afloja un poquito. Let me see. Ok, saquemos todo, no pasa nada. Toma, toma. Dame la guía de nuevo con el esfinterótomo. So I will perform an aspiration just to improve my position, and I will finish putting my pigtail stand. Now it's okay. Okay. So now I'm here. Look, a lot of necrosis is coming out. A lot of liquid from the pseudocyst is coming out. So we are perfect now. So ok, necesito el esfinterótomo con la guía. Okay. Sorry. I lost my position. Look the quantity, huh? Ok, empuja la guía. Ponle un poquito más de... No, de peróxido. 10 cc más. Pasa. No, eso es muy fuerte. Tienen que ser las de 5. So I am using a sphincteroton from G-Tech Medical Supply. This is a very nice sphincteroton. So have a the improvement is that we can perform a rotation of the tip of the sphincteroton, and the tip is already the cutting part of the sphincteroton. One part is covered, so this will help a lot in cases of duodenal wall. In some cases where the duodenal wall is there. So now I am cleaning with the water jet channel of the scope. Okay, ¿cuánto pasaste?
Ahorita van 25 cc, 5 cc
Okay,
de óxido y el resto de solución. Tengo que hacer 10
I am cleaning a little bit more. Sacar el aire. No, ahorita no. ¿Estás lavando? ¿Estás lavando?
La última estoy pasando.
Gracias.
Listo.
Ok, empuja. Vamos a hacer el cambio. So, empuja.
Empujando. Vamos.
Ok, empuja. Empuja. Empuja.
Empujando.
Let me see if we are okay. Déjame ver. Ok, empuja.
No, vamos.
So the position is difficult, huh? I am not using fluoroscopy now. Empuja.
Empujando.
Empuja. Yeah. Sí. Toma. So now we are okay. La prótesis, yeah. You see the necrosis how is going out from the axis stand. So that's why we'll use just a small prosthesis. This is a 7 French prosthesis. This is just a stand. 7 French stand. This is just for avoid contact with the vessel and avoid complication. Necesito que me pongas mejor acá la prótesis.
Ya bueno. A ver, suelta. Vaya.
Hello. Okay. Gracias. So I'm pushing now. Remember that I am using a therapeutic scope, high definition scope of 3.2 millimeters of channel, working channel. But with this stand we can use a 2.8 at least. But this pass very easier just using this look, very easier to pass my stand, my pigtail. So now I'm okay. The distal part is okay, so I will go out a little bit just to... Okay, libéralo. Perfect. So my stand, my pigtail is in place just to avoid a complication. It means a vessel bleeding of due to a vessel that is already detected at CT scan. I will see. I treat the necrosis because of the position of the scope and of this pseudocyst. I treat it with hydrogen peroxide solution with a 5:1 dilution of saline solution using saline solution, and now it's okay, now it's perfect. So I will wait 15 days at least, a new CT scan or US to evaluate this how it's going with this wall of necrosis and pseudocysts, and probably retreat it will depend on of the evolution of the patient. Okay, so I finished the case. Thank you so much, and join us in October 17 and 18. Please subscribe, perform a subscription in our YouTube channel. It's for free, and the club from the training Pentax Training Center Ecuador. Thank you so much for your attention. Okay, perfecto. Sí.